Hello, my name is Dr. Edwin Lee. I'm from Orlando, Florida, and I'm on the planning committee for AMMG. We're here at the Bellagio Hotel in Las Vegas, and it's my pleasure to talk to Dr. Kathryn Retzler. She's from Portland, Oregon, and she is one of the brightest physicians out in the West Coast. So I'd like to talk about how you got into wellness.
Well, thanks for asking. I can tell you, it definitely was a long journey, both personally for me and my family. But I got into age management medicine essentially because it is, holistic medicine and aims to treat the cause of disease, the root cause. My mother was diagnosed with osteoporosis in her 40s, and it became a mission of mine to reverse that for her. So I started prescribing bioidentical hormones when I first started practicing in 2001. And it, from prescribing bioidentical hormones and being trained in treating the root cause holistic medicine, that just naturally morphed into an age management practice.
And you have a unique background because you're a naturopath and you can prescribe HRT therapy, that's fantastic. You bring both worlds into one. You integrate it.
Yeah, the holistic training is my training,
Exactly.
integrative medicine.
Exactly. So what type of patients do you see in your practice?
Well, I mainly have an just exclusive concierge age management practice, so mainly baby boomers, although recently I went and trained with Dale Bredesen in the Bredesen protocol at the Buck Institute for Research on Aging because brain optimization is a huge part of my practice. So even though I tended to focus on very healthy baby boomers who wanted to maintain health or had perhaps become imbalanced but wanted to regain their health, now I'm accepting older patients who have early cognitive decline or Alzheimer's, and I'm willing to work with them because I do believe we can do something about it to slow the disease process and even potentially reverse it. So I tend to see more, healthier baby boomer types, and now I'm branching a little bit more into older patients also.
Fantastic. So what do you think your best, let's say, blessing you've had recently?
Oh, the best blessing I've had recently? Well, I really am interested in my own self-awareness and my own growth personally and spiritually, psychologically. So I think one of the best blessings I've had recently was an injury, a couple of injuries from training, heavily training, and just at this conference, which is one of the amazing opportunities at these conferences, I got my life-length telomere test back, and it was a bit shocking. I'm still trying to figure out how I'm 3 years older chronologically or biologically than my chronological age, because I practice everything I preach with the exception of I'm highly stressed and potentially I overtrain. Still not willing to admit that, but this is going to be a blessing because I'm going to have to change something about my life given the fact that my own personal telomere are not as long and healthy as they should be.
Right. So
that's a blessing.
Anyway, you're going to have a beautiful presentation. So it's going to, what's the title of the talk?
It's on estrogen and testosterone supplementation options for women, and I'm going to talk about the benefits, the risks, and side effects, and then how to prescribe and all the options that are available.
So if you can give like 3 pointers of summarize
highlights. Okay. I always treat hormones as, the icing on the cake. The foundation of health is really diet and lifestyle, but I do believe that hormones are necessary to age well. So I think it's important to know the symptoms of hormone deficiency because the symptoms are going to guide treatment more than any lab testing. So that's a big point. And also to look for side effects. And then to be a teacher for the patient. In other words, my goal is not to try to promote any specific form of bioidentical estradiol or testosterone supplementation for women. I tell them all the options that are available, the pros and cons, my experience, and then help them make an informed decision for them. So that's a biggie too, is that I really believe that's our role as physicians, is to give patients options and partner with them.
Well, what's impressive, I think, on your website is you have a lot of articles, medical literature that the pros and cons.
Yeah, yeah.
So what do you typically say to a patient that says, well, doc, does hormones cause cancer? Because I get that every day.
Well, I do have a handout called FAQ in breast cancer that goes through all the studies, and all my patients read that before they become a patient. I ask them to read that, and they agree that they have read that. And then I look at them as an individual, and I say something like breast cancer is multifactorial and complicated. So I make sure that their hormones are balanced. In other words, I don't prescribe estrogen without testosterone for women. I look at all aspects of their health to see if they're living an anti-cancer lifestyle. I look at their family history. Sometimes I'll do counsel genetic testing with them specifically. And then sometimes I'll even do an oncoblot. I explain to them the pros and cons of that. But it's a lengthy conversation, and I try to provide them as much information as possible. I do think that not giving hormones just because of a fear of breast cancer is probably not the best option. And certainly women are 10 times more likely to die of cardiovascular disease risk than they are breast cancer. So I try to put everything into perspective for them, but also honor their questions and concerns.
So for those healthcare providers that are interested in going to wellness, what was, did you always go cash? Just as fee-for-service
Well,
practice?
that's a great question. I had when I first started practicing, I accepted insurance, and it just didn't work. I felt like my hands were tied in terms of what I could do, and I actually felt like it was unethical for me to continue to accept insurance because I was forced to practice a medicine that I didn't agree with. So the way that we do it, we have a cash practice, and it's concierge-based. The patients pay us a monthly fee. We actually gift that back to them toward their nutraceuticals and IVs and programs that we offer. So to us, they're paying a monthly fee to be a member of the practice, but we're actually gifting that back to them to use toward their treatment. So it's a win-win, and the patients are more likely to be compliant, they get better, and I can practice ethical medicine to me.
Are you happy where you're at?
Yeah, I am.
And you're having fun?
Yeah,
So
yeah,
cool.
yeah.
Because I have a lot of friends in conventional medicine, and they're not happy. They have to work long hours, and the reimbursement's not that great.
I still work long hours, but it's a choice. It's like I'm always learning, and I get to practice the medicine I want to practice, right? So do you. So that's why we love it.
Exactly.
Yeah.
All right. Well, thank you very much.
Yeah.
It was a wonderful time to talk to you.
Thanks, Ed.